After the state witnessed a surge in the day-to-day cases of COVID-19, today till 5 p.m., the state has registered only 3 new positive cases. All these 3 cases relate to returnees who have come back to the state from different parts of the country. This was disclosed by the Director of Health Services, Meghalaya, Dr. Amanwar. Dr. Amanwar also informed that as on date, Meghalaya has 270 active cases. These cases are spread in various districts, namely East Khasi Hills, 236, out of which 179 belong to the BSF alone, 5 from the military and paramilitary forces, while 52 are civilians. In Riboy district, there are 19 cases, East Jaintia Hills 2, West Garo Hills 9, South Garo Hills 2, and 1 each in East Garo Hills and North Garo Hills. Till today, the number of recovered patients stands at 46.
The total number of active cases is 270. East Khasi Hills 236, BSF 179, and members from the armed forces till date is 5, and others 52. Riboy district 19, East Khasi Hills 2, East Jaintia Hills 2, West Garo Hills 9, South Garo Hills 2, East Garo Hills 1, North Garo Hills 1, recovered 46. The number of samples sent for testing is 24,817. The number of persons tested negative 24,199, and the number of test results awaited is 300. The number of entrants from outside the state till date is 21,837. The total active case hado mentag de aspa nyofo hapo East Khasi Hills baro kilong aspa like Rio BSF chispa nyof handai na ki military bat kiwi bari jong armed forces kum ke air force kilong baro khat san bat kiwi badai ki bran po Shillong ki returnees ki contacts ki gidan hang ni kilong san pu a Riboy district Khat Khandai, East Jaintia Hills R, West Garo Hills Khandai, South Garo Hills R, East Garo Hills Iway, North Garo Hills Iway, ki Belajem, South Rio, but ki samples ki ba nipha and test ki hado menta kilong 8,000 Praspa Hanyo ki Bamdan yo khnyang dingpang COVID-19 kilong 8,000 sispa khandai but ki test ki ba ngidang up ya result kilong lai spa ki barung hapo kastir ka jela ka jungi hadu menta kilong 8,000 Praspa life nyo 3 new cases till now kitu ki baki ai namar menden ki ai ki negrams ki siong khat lai ki ong nyo nreu dangila check bhabat ni kitu ki balarung bar khat ki last ki barung hi ban ki banong positive dan negrams ki ar ki bangi ai menden men step ar ngot kitu te bar khat ki ni ki badan khat lai ngot ki balarung pa kidan kitu ki bala test mangiang ni pha corona ke center ki sitom ki lech po negrams ki refer negram kitu balarung kini baro lai ngot ki bathma ki bon phai. You have to go by our official figure. Ours is 46, so it stands as 46. A person who attended what examination?
DSC.
DLC. Okay. No, we don't have any such case. It's going on full swing.
How many?
Yeah, just now I have told 198 for the wedding thing, and the cluster from Kanaparam almost finished. That is why we got the 19 cases. And for Negrams, because it's a huge number. Okay, there are so many people who entered, but not necessarily for all who entered Negrams means we have to contact trace them, but just to be on the safe side. So we are doing from our side, Negrams also is doing from their side for the people who are working in Negrams. So that figure will come out later. The figure which we have given today, this is the correct figure. The reason being, from BSF what is happening, they are duplicating the names. The names which they have given earlier, again they are giving as new cases. So that was the only fault which we had. So now we have already contacted all the patients who are positive. These are the 179 which I have given. 179 BSF. 9, another 7 in Tura, that's why we have got 9. So now we have contacted each and every patient. We have got them, and the others stays as the same. That is why there was a difference in the figure. So now this is the correct and final figure as of today. All those 179 are BSF in East Khasils, including BSF, that is East Khasils. That is why 179 BSF, 52 are others are those who are admitted in a civil hospital, who are admitted in the Corona Care Center, and 5 are the armed forces. Armed forces means the Air Force and the military people. For them, they have what they mean armed forces is what they mean armed forces. For us, when we say armed forces, we have clubbed together Air Force, military, and I will tell you the exact number. Number of positive cases from Air Force is 2. The number of positive cases from military is 1. You remember from Ryangmen, there is 1. Another one was from Assam Rifles, and one more today from Assam Rifles. We have put in. We'll have to put in military hospital. So that is 5. So when we say armed forces from our side, and what they mean and what we mean is that for our convenience, we have said armed forces will include all these: Air Force and military.